patient to emergency OPD. Like that of pain, cough is also important because it is one of our body protective mechanisms which helps us to expel the respiratory secretions and any foreign body which enters to the respiratory system. By itself, it is important, or it's necessary for our body. But if the cough is excess, it makes the patient to become exhausted, it may lead to emesis, it may cause rib fracture in severe conditions. And in long standing, it might result in hernia, urinary incontinence, pelvic organ prolapse, and the like. The cause of the cough always should be treated, and as much as possible, this reflex should be suppressed as soon as possible in order to avoid these complications. So if you say this much about cough, cough by itself can be classified as acute, subacute, and chronic cough based on the duration of the cough. Acute cough is when the duration of the cough is less than 3 weeks. These conditions usually associated with infection of the respiratory tract, like pneumonia, or it may result from like acute conditions like pulmonary embolism. When it comes to subacute cough, it's not that much concerning because it is also called post-nasal drip syndrome. This patient develops subacute cough after they experience viral respiratory tract infections like a common cold. So usually this cough will resolve by itself after a few period of time. When it comes to chronic cough, it is a cough which lasts more than 8 weeks. So if a patient presents with a cough of more than 8 weeks duration, it is very serious because the underlying pathology associated with chronic coughs are serious conditions like asthma. It can be from obstructive lung disease, it can be from lung CA, whether it's primary lung CA or metastatic lung CA. And the other thing is, it may result from this condition like bronchoectasis, chronic bronchitis, and the like. So, it is very serious conditions that it needs detailed investigation and management of the patient. If you know this much about cough, the mechanism of the cough reflex it's almost the same as that of the dyspnea. There are receptors, there are mechanoreceptors which are found on the respiratory tract, and these receptors are stretch receptors and chemoreceptors, and when these receptors are triggered by any external stimuli or spasm of the bronchial muscles, it will stimulate or activate the respiratory centers, and the respiratory center will report to the higher center, to the cortex, and along with the respiratory system, our cortex, along with the respiratory system, will organize the cough reflex via the afferent signals, which is sent through the vagus nerve, the phrenic nerve, and that of the motor nerves, which innervates the musculatures of the chest. So with the coordinative effects of these muscles, will squeeze the chest and increase almost the intrathoracic pressure as high as above 300 mm mercury, and they will expel the sputum, they will expel the foreign body. So it is important reflex and protective reflex for our body. Now let's proceed on how to characterize a patient presented with cough. By the way, before that, during my clinical year 1 attachment, we started our attachment with pediatrics, and it was, I think, our first bedside. And by the time the bedside was prepared on a child presented with cough of about almost 1 week duration or something like that. So by the time the senior asked us to list out the differential diagnosis for acute cough, and one of our friends says otitis media, and immediately the senior became angry with him because she asked him to explain how otitis media causes cough. And by the time, I think he didn't know the mechanism, but he was sure he did that differential diagnosis. So the senior insulted him and the like. Later on, when we check, there are calf receptors which are found in the external part of the ear, and these, when they are stimulated, they cause cough. These receptors are also found by them on the GI tract, on the esophagus, on the stomach, and the like. But their number is few. So by the time, I think the senior doesn't know this, and she insulted him. And you may encounter such kinds of scenarios, but you shouldn't be annoyed. Even you should be proud, because you know what the senior doesn't know. So there are case scenarios which may you encounter like this. So let's come to our discussion, and let's characterize cough. Now let's learn how to characterize cough. Most importantly, the duration, as I mentioned earlier, it can be acute, subacute, chronic. Acute cough can be source of the infection. Subacute, it can be post-nasal drip syndrome. Chronic cough, like serious conditions, lung tuberculosis, lung CA, lung abscess, bronchiectasis, obstructive lung disease, and the like. The other thing is to know whether the cough is dry or productive. If it is productive, then the patient is producing sputum, so we have to characterize the sputum. How do we characterize the sputum? So one important one is identifying its color. Sometimes we may witness if you get the chance, but if you didn't get that chance, we must ask the patient the color of the sputum. If he says it's yellow, it might be associated with bacterial infection, so it might be like associated with lung abscess and the like. If it is greenish, it might be due to pseudomonas infections, or it might be blood tinge showing different serious lung pathologies. And the other thing in characterization of sputum is mentioning about its consistency. Especially patients with bronchiectasis, they will have thick, tenacious types of sputum. Other thing is we have to mention about the amount of the sputum. Like in patients with bronchiectasis produce large amounts of sputum. We can estimate the amounts of sputum the patient is producing by using Arabian coffee cup. And this is important just to know that patients who are producing large amounts of sputum is associated with bronchiectasis. Otherwise, it may not have that much specific relevance. The last thing is the smell of the sputum. If it is foul smelling, usually it's associated with lung abscess. So almost it's typical for lung abscess. The last thing is sometimes the sputum production might be position dependent, especially for patients with bronchiectasis airway. By the way, it's a disease condition associated with permanent airway dilations. We will have next sessions in the future on the respiratory disease details. Anyhow, patients with bronchiectasis will produce sputum when it is gravitational dependent. So, the presence of position dependent production of sputum, it may give you a clue on the patient's underlying disease condition. If you know this much about the sputum characterization, the other important thing about characterization of cough is the presence of diurnal variation, the same as that of dyspnea. Patients with worsening of the cough during the evening and early in the morning are associated with asthma. Otherwise, if the patient has this diurnal variation, then we may consider other differential diagnoses. The other important thing on characterization of cough is the character of the cough. For example, if you have this kind of cough, it's barking types of cough, and it's typical for a child presented with croup. So croup is infection of the larynx, the trachea, and the bronchus by a virus, commonly by parainfluenza virus. Anyways, major objective is just to show you that even the types of the sound of the cough itself is relevant in the diagnosis of the patient. Other thing is, for example, if you are this kind of this is whooping types of cough. Usually it's associated with orthosis. So if the quality or the character of the calf helps you reaching to diagnosis. The last thing that we should know is if there is any aggravating factors. Aggravating factors might be something which triggers the cough, for example, dust, pollen, or certain grains and the like might be the triggering factor for the cough. Especially, it's important to know in asthmatic patients. The other thing is exacerbating and relieving conditions. Usually, cough, for example, COPD patients, the cough is exacerbated when they are on sleeping position, relieved during their own sitting position. So, exacerbating and relieving factor for the cough should be identified if there is any.
Okay, now let's take one sample history explaining about the characterization of cough. The patient presented with a chief complaint of cough of 3 days duration, and on the history of present illness we can characterize the cough as follows. Mr. Muhammad presented with productive, continuous cough of 3 days duration with no diurnal variation and any known aggravating or relieving factors. So this statement explains about the cough, whether it's productive or dry, so it's productive, and whether it's continuous or intermittent, and it also mentions the duration, which is 3 days duration, so it's an acute cough, and the cough doesn't have any diurnal variation, or there is no any known aggravating or relieving factor for the cough. After explaining about the cough, then since it is productive cough, then we need to elaborate about the sputum. So we can elaborate it as follows. Associated with the cough, he produced thick yellowish purulent sputum about half Arabian coffee cup per day, which is not foul smelling or position dependent. So from this statement we can clearly understand that the sputum is thick and yellowish in color, and he doesn't produce that much amount of sputum, which is already mentioned. It's about half Arabian coffee cup per day. So after explaining about the sputum, the cough, then we need to list out any associated symptoms the patient has in addition to the cough. So associated with the cough, he has high-grade intermittent fever, pleuritic chest pain, intermittent global types of headache, nausea, and loss of appetite of the same duration. So this is the way how we should characterize cough.